Hello, my name is Habib Noorbhai, and I'm going to be talking to you about an overview of health and wellness among university students. So there's a number of principles that you would be able to think about that actually governs optimal health and wellness among people, but even among students at the same time. And you will be able to see some of these principles popping up on the screen. And I'm sure that you'd be able to think of any other principles that you think can optimize health and wellness among students and even in your own life. So what I'm going to show you now is a picture which looks extremely similar. And as you see both these pictures, you'll note that they're similar, but there's subtle differences between this picture. And I'm going to start pointing these out for you. And the message from this slide is that although they look exactly similar but with subtle differences, there is a 10% categorical difference between these two pictures. And so from the previous slide, you had seen all those principles that govern optimal health and wellness. And that's exactly what each of those principles have, is 10% can contribute to an enhanced health and wellness if we can focus on it properly and consistently. So that's the effect that these kinds of behaviors and lifestyle factors can have in our daily life. So there's a number of books that you'd be able to read, and it's very important that we try to engross ourselves as much as we can on the literature or the different areas. And there's so many books, there's thousands of books that tell you about health and wellness. The aim of my presentation is to consolidate all this information and to give you some information that you can take away as messages in order to adopt in your life, and as well as if you're working within a university or a school setting, of how we can make our youth and students a lot more healthier. So I want you to think about something. If we could reduce the world's population to a village of precisely 100 people, with all existing human ratios remaining the same, what would the demographics look like? Well, from there, 60 would be Asian, 12 European, 5 US American or Canadian, 8 Latin American, and 14 African. Of those, 49 would be female, 51 would be male, 82 would have dark skin color, 18 light skin color, 89 heterosexual, 11 homosexual. Furthermore, 80 out of 100 would be living in substandard housing, 24 out of 100 would not have any electricity, 67 out of 100 would be unable to read, and most importantly, only 1 out of 100 would have a college education, 50 would be malnourished, and 1 dying of starvation. Furthermore, 33 out of 100 would be without access to a safe water supply, 1 out of 100 would have HIV, 1 out of 100 would be near death, 2 out of 100 would be near birth, and 7 out of 100 would have access to the internet. Now, with the current pandemic of the coronavirus, a lot of these stats would be exacerbated. And if 7 out of 100 people only have access to the internet, how are we actually working from home? So these are the kind of stats that we really need to think about. And the pivotal question from these stats of why I'm actually showing it to you is, how can the optimization of health and wellness in our life assist with these societal challenges that we see around us every day? So before we move on, it's very important to understand the social determinants of health. And the reason why I'm showing you to this is because you may be looking at this video from different parts of the world. And so the current healthcare setup in your country is probably not the same to any other country. And so we can't paint the same picture by using the same brush. And each of these determinants have a different effect on each of our healthcare setup and with each of the societies that we live in. So if you look at these determinants, we look at income and social status, personal health practices and coping skills, health services, biology and genetic endowment, health, child development, education, physical environments, employment, which is a huge issue right now, social support networks. So all of these kind of determinants and more has an effect on people's health and wellness. What's also important is to understand the bridge between wellness and illness, and this shows the wellness and illness continuum. So on the high end of the scale, we have people who have a high level of wellness, and on the low end of the scale, we have people who have a low level of wellness. And a lot of the time, we use health and illness interchangeably. If you're healthy, it does not really mean that you're sick. And if you're sick, it does not really mean that you're unhealthy. And often than not, wellness and illness is used interchangeably. So a lot of these factors would contribute to having a high level of wellness, and a lot of these factors over here would contribute to having a low level of wellness, or otherwise known as more signs of illness. And in the middle, you'd have a neutral point where there's a discernible illness or wellness. So this is important to consider because it's not always the case with every student or the youth in different types of countries. So my talk will cover 4 points. We'll look at physical health, specifically physical activity, nutrition, mental health, and the concept of stamina. So firstly, we know very well the burden of physical inactivity and how so many people are not as physically active as they should be. The World Health Organization estimates that about 2 million deaths are attributable to physical inactivity worldwide every year. More than 60% of men and nearly 50% of women are not achieving health-enhancing levels of physical activity. From a South African perspective, between 10 to 12% of all premature mortality may be attributed to insufficient levels of physical activity in adult South Africans. And according to the Lancet, physical inactivity has been shown to be the fourth leading risk factor for all-cause mortality. It's a high risk factor, especially for non-communicable disease. But what are the stats with regards to our youth? So the consensus of physical activity among our youth, according again to the WHO in 2018, has shown that 81% of adolescents do not meet the global recommendation of at least 60 minutes of moderate to vigorous physical activity per day. Participation in physical activity declines from 70% at age 12 to 30 to 40% at age 21. Nearly 30 to 40% of a decline over a span of about 8 to 9 years, and that's really a significant drop. And a report card that was published in 2018 by Draper et al. For South Africa, they had a Healthy Activity Kids report card that was disseminated along with all the other countries around the world. And from a South African perspective, what was found is that only 48 to 51% of children and adolescents met WHO daily PA recommendation guidelines. And sports participation levels had not changed since 2016. So it's really a cause for concern when we see that there's a degradation or that there's a decline of physical activity levels and sports participation among our youth. Furthermore to this, there are a number of challenging stats for our South African youth. 1 in 5 children or the youth play sport. 2 in 5 smoke or consume drugs. 3 in 5 are physically inactive. 4 in 5 are overweight or have a high BMI. This was another study conducted by Van Rensburg et al. In 2011, and they explored wellness practices and barriers, which was a qualitative study of university student athletes looking at their physical activity, their health, and their wellness. They found that student athletes experience problems adjusting to the university setting and lack the knowledge to address their wellness needs. And the barriers to achieving their wellness included poor time management, poor choice of company among their peers, and lack of transport. And these are the kind of barriers that we need to take into account when working with our students or with our athletes. We published a study in 2014 and we analyzed physical activity and health profiles among senior university students at the University of Cape Town. And the CV risk profile among the students was interesting. A majority of the students had a high BMI, and specifically females had a higher BMI than males. We also had a low percentage of students who were physically inactive. And interestingly, we had a blood glucose level of more than 20% of students had a high blood glucose level. And a lot of these students, the student sample that we tested, had the mindset that because they're young, they're healthy. And I think we need to address that misconception that if you're young, it does not necessarily mean that you're healthy or that you're within the continuum of a high level of wellness. We need to start educating students and providing awareness to them about these important factors that contribute towards health and wellness. So in summary from this study, university students had reported high workloads, lack of time, and logistical challenges to exercise and to assess their health regularly. Cost-effective and accessible exercise and health testing is therefore required to reduce the risk for cardiovascular disease in the student population. And then in another study by Kupu et al. In 2014, they looked at barriers to physical activity in senior students at an urban university at the University of Johannesburg. And they conducted a qualitative study by looking at the prevalent barriers to exercise. So some of the students commented, and I quote, "Exercise tires me, so I cannot study. I am fatigued by exercise. It affects my concentration. Exercise takes too much of my time, and it costs too much to exercise," probably because they didn't have access to a gym or a training facility. After they did a factor analysis, they came up with 4 factors that were categorized in terms of the barriers. And the main 4 factors were costs, time constraints, subjective excuses for why they're unable to exercise, and an inconvenient location in terms of where they were based. So this is helpful information that it can inform us to try and address these challenges or these barriers so that we can make students more physically active. So moving on to my second point to my presentation with regards to nutrition, which is a really important aspect. And we need to realize that there is an epidemic of poor health due to the availability of food, but due to the availability of maybe the wrong macronutrients. So we can see from this global map that there's a daily calorie consumption in 1995, which is a little bit lower compared to when it increases in the 2000s, where we have more people eating a lot more food because there's more availability of food. Near 2020, there's so many deliveries that are occurring that there's an exorbitant amount of food available to those who can afford it. So these are a number of brands that are contributing towards the sugar industry and the carbohydrate industry, which are toxic to people's metabolic health. And the unfortunate truth, which is well positioned by Wendell Berry, he says, and I quote, "People are fed by the food industry, which pays no attention to health, and then are treated by the health industry, which pays no attention to food." And so what we see is that there's an incongruity between the food industry and the health fraternity. They're not speaking to each other. In the current context of the coronavirus pandemic, we can see that those who are infected with the virus are more likely to develop severe cases of the virus or unfortunately die because of the metabolic health profile. We are looking at certain patients who have markers of type 2 diabetes, who have high blood pressure or hypertension, and who are obese. And this can also be reduced or prevented if we start focusing on what the wrong and the right macronutrients are. We need to start focusing on eating right to reduce the onset of metabolic health diseases. And if this is focused on, then when these viruses come about again in the future, the pandemic or the mortality rates among people can be lower than what we're currently seeing right now. So there's a number of books here as well that people would be able to read when it comes to nutrition. What type of diet should they follow? What type of eating plan should they follow? Unfortunately, when it comes to the student population, it's mainly about survival. They eat to survive. It's not a matter of what they can or what they can't eat, because we see that there are socioeconomic disparities that currently exist within our student population. So generally, we see that eating habits among students are generally poor, and this is a real cause for concern. So an interesting study in 2012 by Guns et al. Showed the relation between eating habits and a high body mass index among freshman students in the West. And this was a cross-sectional study. And they found that the effects of eating habits on increased BMI were analyzed. Of the more than 2,000 subjects that were included in the analysis, 322 were overweight or obese, and 1,937 had a normal BMI. So this was an odds ratio that they had done with the number of factors that had contributed towards the BMI. And here we can see with alcoholic beverages, frequent consumptions of beer, alcoholic drinks other than beer and wine, as well as Coke, were associated with a significantly high risk of obesity and being overweight. And into conclusion, their consideration into the absolute quantities of consumption, along with cultural and local issues, would guide the adoption of healthier feeding behaviors among students within a university context. So this kind of information really helps us because it shows what kind of food or beverages are available on university premises and what students are consuming out of university premises or even within their student residences. Then this was a study by Gradage and Cohen in 2018 in South Africa, where they look at the BMI and associated lifestyle and eating behaviors of female students at a South African university, and this was at the University of the Witwatersrand. And they showed that those students with BMIs of more than 25 kilograms per meter squared were less likely to be physically inactive, and they used to purchase fruits than those with normal BMIs. Now, you're probably asking, how can you get more, how can you increase your weight with eating fruit? And the consensus is that fruit does have natural sugar. So if you have too much of it, although at times it can be affordable, it will put up your weight. So the consensus there is that you should rather have vegetables instead of fruit. In addition to that finding, close proximity to food vendors, peer influence, sitting time, and purchasing fried foods more than 4 times per week were positively associated with BMI. Sitting time is the real calls for sedentary behavior. As I'm doing this lecture, I'm standing, and we really need to try to prevent the onset of sitting time and increase the amount of standing time. Our students in university classes, a lot of our universities have desks and chairs. It increases student time. When we lecture students, sometimes you see students are falling asleep. It may not be due because of they're having a lack of sleep, or that there may not be an adequate aircon within the classroom, but it could be due to their diet. So this is the kind of information that we really need to take into account. So in conclusion, they have concluded that public health initiatives addressing obesity should target the high sitting times of students and eating behavior, particularly during the period of transition from adolescence to adulthood. We showed from the previous slide, the WHO in 2018 showed a reduction in physical activity from the age of 12 to the age of 21 by 30 to 40%. And similarly here, they are also finding that during the period of transition from adolescence to adulthood, there's a public health concern. This brings me into the third point of the talk, which is mental health. And it's a factor and a determinant that is increasing rapidly, not just within student settings, but even in society at large. So this was a study conducted by Extremera et al. In 2006, and they looked at the emotional intelligence as a predictor of mental, social, and physical health in university students. Their results showed that a high emotional attention was positively and significantly related to high anxiety, high depression, and low levels of social functioning and mental health. On the contrary, when they looked at high levels of emotional clarity and mood repair, this had opposite results. It was related to low levels of anxiety and depression and higher social functioning, mental health, vitality, and general health. So they showed that emotional clarity and mood repair had a better effect on these symptoms compared to high emotional attention and positivity. And these are the variables that they had looked at with regards to their predictor in terms of the variables that had governed the emotional intelligence variable. And they confirmed that the predictive value of attention, clarity, and mood repair regarding the levels of anxiety, depression, and areas related to mental, social, and physical health in university students was really important. And it showed that there was a predictive value between these variables as well as a low or a high emotional intelligence. And then there was a study conducted by McCaskill in 2013, which looked at the mental health of university students in the United Kingdom. And they had investigated more than 1,000 students who completed a general health questionnaire. And they looked at different types of measures on different 7-item scales, including somatic symptoms, anxiety and insomnia, dysfunction, and as well as depression. And interestingly, they had very interesting results. When they had a total GHQ score of all of the symptoms that they investigated, they found that when students came into university, they had a GHQ score which was just less than 22, which was fair. It had a slight decrease when they went into first year, but interestingly, there was a rapid increase when they went into their second year, which was more than 26, and then a slight decline again into their third and fourth year when they started graduating. So this was a really interesting finding, that the anxiety levels and the depression symptoms or social dysfunction mainly occur during the mid phase of a student's degree at the university. So rates of mental illness in students equal those of the general population, but only 5.1% were currently receiving treatment. Second year students, as we can see in this graph over here, reported the most significant increases in psychiatric symptoms. So that was really important, and we are not sure if this is similar to the African or the South African context, but this is the kind of information that we need to take into account in order to assist our students within a university context. And then lastly, Minutilo et al. In 2020, which was recently published in the Journal of Issues in Mental Health Nursing, spoke about mental health considerations for our international students. Now, when international students are traveling to different countries abroad, away from their home, there are different types of considerations that need to be taken into account. And they've concluded, and I quote, irrespective of the number of international students in an educational setting, and given the steady growth in the number of students seeking educational opportunities overseas, there is an urgent need to ensure that adequate resources are provided for the support of all international students across all aspects of academic life. The importance of maximizing the benefits and minimizing the risks associated with international study for overseas students cannot be overstated. A quality experience for all, underpinned by an evidence-based and resource safety net of support, with specific training for mental health professionals should be considered a global industry standard, and this needs to be adopted with universities across the globe. This brings me to the last point, which is the concept of stamina. Now, when you read the word stamina, you're probably thinking it's about endurance or how many sit-ups or push-ups that you can do. Well, that is right, but what I'm trying to tell you is a different type of concept of stamina, that it's not just physical, but it's mental as well, and it's social as well. So what I'm going to show you here is a mountain, and that is Mount Everest, and that which is the highest point peak in the world for a mountain. And then this is Table Mountain, which is one of the flattest peaks in the world. And I want you to think about what the differences is between these two mountains. A number of you will probably say Mount Everest is a lot higher compared to Table Mountain, higher altitude, which is correct. But the difference here is that for the majority of hiking up Mount Everest, it's a steep walk. Where with regards to Table Mountain, depending on which trail you take, it's a steep climb. So the difference between these mountains could be seen based on endurance, or it can be seen based on strength. And there's no right way of how you see it. It's all about how you apply the concept of stamina. So the message from this slide is that stamina can be defined in different ways. And each student that we see in university, when it comes to health and wellness, they're applying their concept of stamina in different ways. They're applying their own adaptation to the location that they're in and the different types of circumstances that they have in their own way. And a lot of the time they're fighting different types of battles on their own. So it's very important to consider that the concept of stamina is relative across different students and across different universities. So in an interesting study, which was conducted at the University of Free State in South Africa, they looked at food insecurity among students. And this was a really interesting study because it actually adversely affected students' education. So 60% of the students experience food insecurity with hunger, where 26% experience food insecurity without hunger, which was a really interesting finding. And the highest prevalence of food insecurity was in black and colored, undergraduate, and first generation in male students. When I talk first generation, these are students that are going to get a degree, who are the first generation students to get a degree in their family. Okay, so there was a lot of responsibility and accountability on them because their families back home are depending on them to provide for them after they actually graduate. As well as in students who are unmarried, unemployed, and those relying on loans or bursaries. And the strongest significant predictors of this food insecurity were race, gender, being a first-generation student, not having enough food money, having borrowed money from parents, having asked for food, and having sold belongings in order to obtain food. These students are doing different types of measures and applying different concepts of stamina, not only just to survive, but also to apply different attributes so that they can be able to see through their degree and pass and graduate. And these are the kind of things that we need to take into account in every bit that we do, whether we are a faculty member, whether we are a support staff member, whether we are guardians or parents of students. Every role that we play and contribute a minimal part can really help the current landscape with students in universities, not just within South Africa, but globally as well. So in conclusion from the study, they saw that severe food insecurity in students may be contributing to the high attrition rates experienced by universities in South Africa. Urgent intervention is required, as not having access to enough nutritionally adequate and safe food could be one of the reasons why more than 50% of South African university students never graduate. That is a colossal finding, that not having sufficient food or not having nutritionally adequate and safe food is a reason for why more than 50% of our students are not actually reaching graduation. Okay, so food is not just the basis for physical wellness, but also the basis of psychological wellness and concentration in order for them to really be successful in their studies. So if you look at consistency with that finding, if we look at the studying stamina graph that I've showed here, a lot of students don't just want to get their bachelor degree. They want to go right up to the doctoral level. But in different stages, there are challenges and obstacles that they have to grapple with. So before they even start a bachelor degree, some students want to take a gap year, or maybe they want to take a gap year after their bachelor degree. If they do go on to study the honors level, they then probably say they're tired to study further, they want to work to make money, their families are relying on them as per the challenges that we've just gone over in previous slides, so they need to start working. Or when they do start working, they're doing their masters, And after they completed their masters, they may lack the research stamina to carry on further because of so many challenges that they had addressed. So studying stamina is one aspect that we need to consider. And there are so many factors that we would be able to notice that contribute to this curve. How many students are actually able to go from the bachelor to the PhD level with so many challenges that they are actually putting up with? And why I'm presenting this graph is it because it has a direct proportion to the health and wellness kind of situation with the students. The health and wellness is really important in determining the studying stamina of each student. So in summary of my lecture, I would like to give you 10 takeaway messages. And the first one is that we've seen that sitting time is an issue, and it's recommended that at universities, standing desks should be offered in classes so that students have an opportunity to not just sit down, but to also stand at times. The second recommendation is that physical activity programs should be offered for students. We currently reside in the fourth industrial revolution where different apps can be integrated, different types of solutions, innovations can be integrated to enhance physical activities. And I think this is really important for a lot of universities to consider despite the socioeconomic disparities that we're facing with. The third aspect is that sugar is the real poison when it comes to macronutrients, not the fat. And obviously different types of fat is a lecture for another day from a physiological perspective, but we must understand that those foods that are cheaper yet higher in sugar is the real poison. And that can also cause decrements not just in concentration, but actually increase that curve of BMI and weight within our students. University canteens therefore need to revisit their menus. How many times do we see our canteens at universities? Although they're offering food that is affordable to our students, it's not really healthy for their health and wellness. And this is something that really needs to be offered and revisited, and where certain foods can be subsidized so that students can actually afford it. So I'd like to encourage a lot of executive managements at universities around the globe to really focus on the canteens at universities so that they can try to improve the amount of food that is being offered to students and where students can buy it on a more affordable basis. The mind is the most underestimated director of the entire body, and we need to place a lot of emphasis on it. And that's why we have to do so much of education, awareness, motivation, achievement motivation. Those kind of psychological attributes need to be enhanced, not just out of the classroom, but within the classroom. I think we as lecturers are not just gatekeepers to their student success, we are gatekeepers to their life success in terms of how we can share certain factors that we've learned in life and how we can motivate them so that they can not just have a stronger knowledge base of what we teach them, but also a stronger mind. And I think that's really important to inculcate within a university context. Mental health is on the rise. We're seeing devastating stats, and we really need to start paying more attention towards mental health. We're seeing symptoms of depression, anxiety, suicide. We need to look at different ways of how we can curb this challenge, and it's an epidemic on its own. Legislation and education is needed in every country with a number of issues that I spoke about today. Physical health, mental health, nutrition, different aspects of health and wellness really need to be addressed through these types of regulations and education in universities. Cost-effective gyms or facilities are required. A number of universities have these facilities, but either they're not up to a certain standard or it's too expensive for a lot of students to pay for. And one of the suggestions from a number of universities is to actually integrate the costs of these gyms or facilities in the students' fees structure. And it's obviously difficult and different for a number of universities because some of these gyms or facilities are external to the university. But if some kind of recommendation can be put in place to allow for these facilities to be more cost effective, we will be able to see a decline in physical inactivity and hopefully an increase in the amount of activity and exercise that students are partaking. In effect, if those students are more active and exercise more, they are actually more prepared for exams and more prepared for certain academic activities. So it's a win-win situation for both. Technology is like water. It can either be advantageous or disadvantageous to the health if we are not using it carefully. We are currently residing in the fourth industrial revolution. The fifth industrial revolution is not too far from where we are right now. And so we need to apply this in a very careful situation and use it smartly to optimize health and wellness for our students. And lastly, we need to align all of these health and wellness imperatives and strategies to the United Nations Sustainable Development Goals. So if we look at the 17 Sustainable Development Goals, that have been put forward to transform our world, we can see that number 3 is really important here. Good health and well-being, and not just number 4, looking at a quality education. So thank you very much for listening to me, and I'm happy to take any questions.